If you've ever wondered, aren't Advantage and supplemental plans the same thing? They're not. Choosing without understanding the differences can cost you thousands of dollars or limit which doctors you can see. By the end of this episode, you'll know exactly how each option works, what's changed for 2026, and a simple checklist you can use to choose confidently.
Welcome to In Good Company, elder care in your backyard.
Hi everyone, welcome back to In Good Company. I'm Spencer Ernst, and today we're tackling one of the most confusing decisions people face around age 65. Medicare Advantage versus Medigap. What's the real difference in 2026? And how do you pick the right path for your health and your wallet? What Medicare actually is and isn't. Let's start by laying the groundwork in plain English. Original Medicare is made up of two parts, Part A and Part B. In 2026, most people will still pay $0 for Part A if they work roughly 10 years. For Part B, the standard monthly premium is projected around $190, up slightly from 2025's $185. There's also a Part B annual deductibles for $265. If you're a higher earner, you'll continue to see IRMA, the income-related monthly adjustment amount, which adds a surcharge to your Part B and Part D premiums based on your 2024 tax return. Here's the catch. For most Part B services, Medicare covers 80%, and you're responsible for the remaining 20% with no annual out-of-pocket cap. That means a major surgery or chronic condition can lead to open-ended bills. To protect yourself, most people choose one of two paths: Original Medicare, a Medigap supplement plan, a standalone Part D drug plan, or a Medicare Advantage plan Part C, which bundles hospital, medical, and usually drug coverage in one private plan. Your two main paths. Think of this decision as a fork in the road with two very different driving experiences. Path A, Original Medicare plus Medigap plus Part D. This route is likely taking a toll road. You pay an upfront fee, your premiums, and glide through most of the financial traffic. Your costs are predictable, and you can see almost any doctor nationwide who accepts Medicare. Path B, Medicare Advantage Part C. This path is more like taking local streets. You might find some $0 premium plans, but you'll pay as you go, co-pays, co-insurance, and deductibles, up to an annual cap. You'll also stay within the plan's provider network most of the time, and certain services may need prior authorization. Let's break down each path so you can see which one fits your lifestyle and budgets best. Medigap, how it works in 2026. Medigap, also called Supplemental Insurance, fills in the cost gaps left by Original Medicare. These plans are standardized by letter: Plan G, Plan N, and others. A Plan G is identical in benefits, no matter which insurance company sells it, but pricing and rate stability can differ. Plan G. You can pay Part B deductibles, $265 in 2026, and after that, nearly all Medicare-approved services are covered for the year. This is the most popular choice because it's predictable. No surprise copays or co-insurance once you've met that small deductible. Plan N. Similar coverage to Plan G, but you'll have small copays, around $20 for office visits, $50 for ER visits, and you won't be covered for Part B excessive charges. Those are extra fees some doctors can charge above Medicare's approved rate. The good news: several states have outlawed excess charges entirely, making Plan N very attractive in those areas. Doctor access. This is where Medigap shines. There are no networks. If your provider accepts Medicare, you're covered. That means freedom to see specialists, second opinions, or doctors in other states, especially important for travelers or snowbirds. Prescription coverage. Medigap doesn't include your drug coverage, so you'll add a standalone Part D plan. And here's one of the biggest benefits rolling over from 2025 into 2026. The $2,000 annual out-of-pocket cap on Part D prescriptions remains in effect. That means no one will pay more than $2,000 a year for covered drugs, regardless of how expensive they are. You can also smooth those costs, spread them evenly across monthly payments to avoid big spikes at the pharmacy. If you skip Part D, you'll face a lifetime late enrollment penalty. So even if you're not on a medication today, it's worth enrolling in an inexpensive plan. Who this path fits? 1. You want maximum provider choice and predictable medical costs. 2. You dislike prior authorizations and insurance red tape. And 3. You can comfortably budget for a monthly Medigap premium plus a Part D plan. Medicare Advantage, how it works in 2026. Medicare Advantage plans are run by private insurance companies under contract with Medicare. They're required to cover everything Original Medicare does, but they do it with their own networks, cost sharing, and rules. You'll still pay your Part B premium, around $190, but most Advantage plans have $0 or low monthly premiums beyond that. Cost structure. Advantage is a pay-as-you-go model. You'll pay copays for doctor visits, outpatient procedures, imaging, and hospital stays, up to an annual maximum out-of-pocket limit, or MOP. For 2026, CMS allows in-network MOPs up to $9,500, though many plans offer lower limits. Out-of-network, if your plan allows it, can have a separate higher cap. Networks. Most Advantage plans are HMOs or PPOs. HMOs require you to stay with the network except for emergencies. PPOs allows more flexibility, but at a higher cost. Always confirm your doctors and hospitals are in network and recheck every fall because networks can change annually. Prior authorization. This remains a sticking point. Advantage plans often require approval before surgeries, advanced imaging, or certain therapies. It can delay care or add administrative steps, though CMS has been tightening oversight to make the process smoother. Extras. One advantage of Advantage, pun intended, is the extras. Some coverage for dental, vision, hearing, transportation, or fitness benefits. These perks are great, but don't let them outweigh the core question. Does this plan meet my medical and drug needs first? Who this plan fits? 1. You prefer lower or $0 monthly premiums and don't mind paying as you go. 2. Your doctors are in network and you're comfortable with the managed care model. Or 3. You'll stay proactive, reviewing your plan's annual notice of change, your ANOC, each fall to catch any updates. Part D in 2026, the game changer. Whether you choose Medigap Part D or an Advantage plan that includes Part D, 2026 continues the drug cost revolution that began last year. The $2,000 annual out-of-pocket cap remains a game changer, protecting beneficiaries from runaway prescription costs. You can still choose the smoothing option, letting you spread these costs evenly over the year, great for anyone on a fixed income. That said, formulary details still matter. Always check, are your specific medications and dosages covered? Are they on a preferred pharmacy tier? Is your pharmacy in the plan's preferred network? If you're not taking meds, it's still wise to enroll in a low-cost plan to avoid the lifelong penalty and preserve flexibility for the future. Enrollment windows, don't miss these. There are 2 timing windows that can make or break your options. 1. Medigap Open Enrollment. You get a one-time 6-month window starting when your Part B plan begins at age 65. During this time, Medigap is guaranteed issue. No health questions or underwriting. After that window closes, insurers in most states can ask health questions or deny coverage based on medical history. If you like the Medigap path, don't miss this window. 2. Annual Notice of Change plus Medicare Open Enrollment. If you're already in Medicare Advantage or Part D, your plan sends an annual Notice of Change each September, showing the next year's changes. From October 15th through December 7th, you can review, compare, and switch plans for the upcoming year. Read that letter. It's your best chance to catch changes to your doctors, drug coverage, copays, or networks before January the 1st. Real-world scenarios. Let's make this real with few examples. Scenario A. I travel a lot and want provider freedom. If you travel in another state or simply prefer flexibility, Medigap plus Part D is your best friend. No networks, no referrals. If they take Medicare, you're in. Scenario B. I'm healthy, budget conscious, and my doctor is in a strong local network. You like the idea of low monthly premiums and don't mind paying as you go. A Medicare Advantage plan can make sense. Just verify your doctors and prescriptions every fall. Scenario C. I take expensive medications. The $2,000 cap helps everyone, but formularies still matter, whether you're using Advantage or Part D standalone. Always check your exact medication, dosage, and pharmacy. Some plans still price drugs differently across tiers. Your 7-point 2026 checklist. Grab a pen or screenshot this mental checklist. 1. Doctors and hospitals. List your must-keep providers. Are they in-network for your Advantage plan? If not, Medigap may make more sense. 2. Medications. List every drug, dosage, and preferred pharmacy. Compare formularies carefully. 3. Budget style. Prefer steady monthly spending? Go Medigap. Want low upfront costs? Advantage might fit. 4. Travel and snowbirding. Medigap's no-network model shines if you get care in multiple states. 5. Red tape tolerance. If prior authorizations drive you crazy, Medigap cuts that hassle. 6. Timing. Don't miss your 6-month Medigap open enrollment or the annual October 15th through December 7th window. And 7. Annual recheck. Review drug and Advantage plans every single fall. Costs and networks change yearly. Common misconceptions rapid fire. Let's bust some myths quickly. Myth: $0 premiums mean zero costs. The truth? Advantage plans still have copays and coinsurance until you reach your out-of-pocket cap. Myth: all doctors take my Advantage plan. The truth? Not necessarily. Advantage plans have networks. Confirm yours every single year. Myth: I can switch from Advantage to Medigap anytime later. Truth: after your first 6 months on Part B, you might face health questions or denials in most states. Myth: I don't take meds, so I'll skip Part D. The truth? Without credible coverage, you'll owe a lifetime late enrollment penalty. Enroll in a low-cost plan now. Putting it all together. So, how do you choose? If you want maximum flexibility, predictable medical costs, and are comfortable paying a monthly premium, Medigap plus Part D gives you peace of mind and less red tape. If you want low monthly premiums, your doctors are in-network and you don't mind managing copays and authorizations, Medicare Advantage can be an excellent value. There's no wrong path, just the one that fits your lifestyle, providers, and comfort level. Final tips and a call to action. Here's what you can do next. List your doctors and prescriptions. Decide your budget style, steady premiums versus pay-as-you-go. Use Medicare's Plan Finder or a licensed advisor to compare your options in your zip code. Mark your calendar for key windows. New to Part B at 65? Don't miss your 6-month Medigap window. Already enrolled? Review your plan each fall from October the 15th through December the 7th. Keep screenshots or notes of your research, plan details, formularies, and network confirmations. And remember, today's episode is for education, not individualized advice. Your situation is unique, so talk with a licensed Medicare advisor to review your exact doctors, medications, and needs for making a decision. That's it for today's In Good Company Elder Care in Your Backyard. If this helped demystify Medicare for 2026, share it with a friend turning 65 or a family caregiver trying to help someone navigate this maze. I'm Spencer Ernst. Thanks for listening, and I'll catch you next time. And always remember, you're in good company. If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company Elder Care in Your Backyard. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.